Hi, I'm Dr. Rich. I'm teaching you about dentistry and teeth so you can have a very nice smile.
Thanks for joining me today. Today we're going to be working on a lower first premolar, tooth number 28. So right now I'm going to isolate it with my rubber dam. And so because of the situation where this tooth is, I'm going to do something a little bit different. I'm going to clip the tooth behind it. So that's the molar there. And then we're going to isolate the other two teeth. And if you notice, there's a big gap between the molar and that premolar. He's actually missing the second premolar, and over the years that the tooth's been gone, the molar has shifted forward into that space. So now that space is a little too big to fill with a filling, so I'm just going to fill it in. I'm just going to repair the tooth to the contour it's in. And because of the person's situation in their upper arch, I decided to use the rubber dam rather than the isolate like I normally do. So I have the molar isolated. Now we got the rubber dam in between the other two teeth. And as a precaution, I'm just going to use a smaller little clamp on that canine just to help hold the rubber dam in place. That way I don't have to worry about the rubber dam popping off. And now let me just stretch it on the framework, and we're going to be pretty much ready to go to restore it. Now, why do I like to use a rubber dam when I'm placing a composite? I like keeping the tooth dry. Got that in position, and now here's a close-up. You can see some staining on the occlusal there, but if you look in between, it's a little hard to see it because there's not a lot of room. But right there, that's the cavity right there in between the tooth. It's not a huge area of decay, but we got to get rid of it, otherwise it's going to keep growing bigger. So first thing I like to use is a 245 burr in my high-speed handpiece, and with this I'm just going to prep it for a class 2 composite filling. And a lot of times just prepping it removes most of the decay, not all of it, but most of it. So we're just drilling it through. I like using the high speed. You need to use the high speed to get through the enamel. Now let's clean that off a little bit, take a closer look, see what the situation is. And as you can see, there's still a little bit of decay in there, but most of it's been removed. But like right there, it still feels a little soft. So next, to remove that, I'm going to use a round burr in a slow speed handpiece. I prefer to remove decay with a slow speed, just how I was taught way back when in dental school. And I feel like I have a better feel for it too. Like to cut healthy tooth structure, you need to really use a lot of pressure. So just a light touch with the slow speed, and I'm removing just the decayed area. All right, let's clean up those shavings. Take a look at what's left of the tooth. There you can see it. No, it looks pretty clean now. And sometimes I'll use some sometimes I will use some caries indicating dye, but in this case I'm just going by feel. So I want it to feel nice and solid, nice and firm, no soft spots anywhere. And just checking the inside, bottom of it, all around. Now that it's all cleaned up, next I'm going to go back to the high speed, and I'm just going to bevel the edges of the filling. So with the enamel, you want it beveled when you're placing a composite resin filling so that you have more enamel to bond to. Clean that all up, and we'll do one last final check before we start restoring the tooth. Okay, checking, making sure everything's okay. Just that little schmutz left over on my Explorer tip. Everything feels good. Might be a little bit of a lip there on the bottom edge of that box, so I'm going to take my spoon excavator and just kind of flick that off if there's anything there. I was actually taught years ago how to use enamel hatchets and hose to basically use a hand instrument to dress some of the enamel in those areas. I don't actually use them anymore. I still have them in a box somewhere in my storage closet at the office. All right, we're ready to restore. Just going to use a regular matrix band and a Tafelmeyer retainer. This is not a grater curve, and because of that huge gap between this tooth and the molar, I'm not going to use a sectional matrix because there's no way I'm going to be able to close that distance with just a filling. If the person really wanted to close it, you could try to close it with a crown, but he didn't want a crown, so we're just going to leave the space, and it's going to be easy for him to clean it. So there we have it. Flip on my yellow light, and now here's the bonding agent that I use. Of course, I use Surpass. So I usually use these 4 well mixing wells. The first one is going to have my Surpass 1. That's the etchant. Second little well is going to have my Surpass 2. That's the primer that neutralizes the Surpass 1. Surpass 3 is down in the bottom left, and then finally seam free in the bottom right. And I always dispense it the same way so I know which little well has what product. So 10 seconds of Surpass 1. Let me put a little bit more on there. The brush seemed a little dry. This just conditions it, gets the tooth ready for the bonding. It's the first step, first bottle of the 3-bottle system. Put that all in there. Make sure agitate it a bit. Next is 3 coats of Surpass 2 in the purple bottle. This just neutralizes the etchant, primes it, gets it all ready. So once I have the 3 coats on there, I just dry it really, really well with just some air from my air water syringe. And then once that's done, now it's time for the bonding agent, the actual resin itself. That's going to be the Surpass 3 in the blue, out of the blue bottle. Put a little coat like this. Now put a coat on there, make sure everything's nice and wet. Now in small fillings like this, I always like to air thin it just so there's no big pools of bonding agent way down deep. So we got a nice even coat, so let's blast it with my Vit-l-essence curing light. 10-second cure. We'll set it up, and then we're ready to go on to filling it. So the first thing I use, first thing I use is going to be some flowable composite. I use Titan, and I just put a tiny little layer in there just to coat the bottom of the box, make sure it gets into all the nooks and crannies, and works and up to the matrix band. And once that's in place, hit it for 10 seconds with the curing light. And now, because it's so small, I'm not going to use any more of the flowable. I'm going to start building it up with the paste composite. In this case, I'm using Vit-l-essence by Ultradent. I believe this is shade A2. And so what I like to do when I'm restoring a class 2 filling is I like to build up that proximal wall on the side to turn it in a class 2 into a class 1. So basically, instead of it having a hole on the side of the tooth anymore, we're going to build that wall back, restore it, and once that's cured up, then we can fill in the hole in the center of the tooth. So I'm just shaping it with my cord packing tool so I can get in there, and then again hit it with the Vit-l-essence curing light for 10 seconds. All right, so now that wall is done, I can remove the matrix band since it's all sealed up on that side. And especially with the rubber dam, I don't have to worry about any contamination. And so now there's just a little hole left on the biting surface. So if it was very deep, I would add another layer of flowable composite to help fill it in. But because it's fairly shallow, I'm just going to fill it up with some more of the paste composite, the Vit-l-essence. And again, just put that in there with my cord packing tool, dip it in some seam free to be able to smooth it and shape it so it doesn't pull, doesn't stick to my instrument. And I just place it, take my time to place it perfectly. And again, I'm using the contours of the teeth to get the shapes of the angles of the cusp tips just to help me shape the filling, because once it's in place, I can play around with it until I'm ready to cure it with the curing light, and then it's set up. And hopefully this way too, the more time I take to make sure I place it properly, I don't have to. There'll be less time for me to have to adjust it at the end. All right, so let's turn the yellow filter off and let's take a closer look. Now I can see there's a little bit of flash. That's the bonding agent after I air thinned it before I cured it. So a lot of times that'll just flake off because I didn't treat that part of the tooth with the Surpass 1. Another thing I'm noticing is that marginal ridge there is a little sharp just because of the matrix band. So I'm going to round that off with a green stone in my high-speed handpiece, just so it's a little bit more rounder and not as sharp, because the patient will feel that with his tongue. And now I'm just taking, that's pretty much all the shaping of the composite I'm going to need to do. Now I'm just taking my Jiffy polishing brush, seeing if I can remove any little bit of that flash of the bonding agents on the sides. It's still there a little bit, so I think I am going to have to go back and hit that with the high-speed handpiece just so there's not a ridge that the patient can notice with their tongue afterwards once the Novocaine wears off. And I'll do it on both sides, just make sure it's nice and round. Alrighty, dry that off. take another look at it. And hit it with the polisher once again. Just right where I adjusted it, just to have a nice smooth finish. So one final clean off, and let's take a look at it, see how it looks. Looks good. It blends right into the tooth. I love the Vit-l-essence. It's a little bit translucent, so if you can get a fairly close shade match, it will disappear into the tooth. You won't see it at all. All right, now we remove the rubber dam, and last thing's going to be to check the bite on it. Check the occlusion with some articulating paper. Well, in most cases, that's what I do. In this situation, based on the person's bite, nothing to worry about. Blends right in. All right, thanks so much for watching. Hope to see you guys all in the next video.